colleague, Mr. Amr, is having a look at the questions at the moment. So, Amr, have
Yes,
we got?
that's fine. Welcome, everyone. Okay, can I start with Dr. Hatem? There's a couple of questions. Someone asked, is there a preferable CV template that you would like to recommend?
Okay, so a pre-filled template, I'm not quite sure about that. There might be one or two, but I believe the GMC in itself, the General Medical Council in the UK, have already put in its webpage the minimal requirement that should be included in your CV. And as far as I'm aware, most of the information that has been put in there is already in the presentation. So all the items has to be fulfilled, but a pre-filled template, which is preferable by the GMC, you can find the details, but there will not be like a one which you just fill your information on.
I just want to make a comment about application for jobs now. Most of the trusts now use a track system or similar system. Use the template, not use a CV. So when you do a CV, this is your for record, and you keep all the information there. And then when you apply, you take parts from your CV and put it in this template. Another trick you could do that with the CV, you can send it actually in the advert of the job, you'll find a responsible consultant. You can send the CV as a supplement of your application. What I would advise as well, when we look at the template or which is used by the trust, there is a scoring point. Last job, it's about 50 people applied for a job for senior clinical fellow in ENT. We have to score everyone. So there is section like about previous experience, your jobs, then your research, and then about audit or effective change, different section. My advice, don't leave any section without putting something in it. For example, if you ask about research, okay, maybe you didn't do research, but you did master degree. So put your master degree there, and what was the outcome of it? Or if you went for a course and did some presentation, or you did a poster in a meeting, put this in the research. Don't leave it empty. Again, for the effective change or the audit, they keep changing the name. Again, lose your master degree. Use your master degree to put something out of it. So be creative when you do your application. The template now, most of the trusts use the template to make it easier for them to score the candidate. If you have 100 candidates, you cannot just look at the CV and throw some away like you used to do all day. Every candidate has to be scored, and you have to make sure that you put something useful in every section. The other thing, when you apply for a job as well, you have to know what you want from this job, because you will be asked about this in the interview, and also you can add it as a part of the section at the end. Don't apply for jobs just for applying for jobs. Is this job is going to be useful for you? Is it going to progress your career? Think about that. Thank you.
Thank you very much, Mr. Atif. Thank you very much. Walid, there was a question saying, what do you mean by disclaimer? I know this is a simple question, but I actually wanted you to actually clarify it for
I am delighted. I'm delighted. It's a good example for communication. If you don't know, just don't let it go. Don't pass it. You have to ask. If you don't ask, you didn't get an advice from my lecture. So thanks very much for who asked that question. Disclaimer means I am washing my hands if it happens to be sent by mistake to the receiver and it was meant to be for someone else. Please delete that email. Consider that you did not receive it. I would appreciate if you contact me to say this email arrived to me by mistake, but at least you have to delete it. That's the disclaimer. So it's kind of, I'm washing my hands if this happened by mistake. It's kind of the legal responsibilities.
Thank you very much, Dr. Walid. Thank you. I'm going to try and continue with the questions that are actually written, and then I might have a question or two, if you don't mind, from myself. There's a question, I'm going to open this to the floor, and whoever's happy to answer from the kind speakers. Someone asked, how do you join an academic training as an IMG, if it is even possible?
This is the next section, Amr. The whole next section is about that.
Fine. I will. I'll leave the answer to the next section. Okay. From me, and this is to Dr. Hatem. Part of the mentioning that you talked about in the CV is the leadership and management, and you very kindly said it's not just being a consultant that means that you're the leader. You have to talk. You do leadership and management even as a junior person. I know you did give a very short example, but can you elaborate what they can write from a leadership and management point of view, or what they can do and write if they're a junior person? Because not every IMG that's coming is actually a consultant who is leader.
So there are multiple facilities that you can be involved in leadership and management. So if you are involved in the rota management for your colleagues, if you are a junior and you are doing the rota for your colleagues, this is some sort of management that you are doing. If you are involved in a morbidity mortality meeting, or you are responsible for the hospital doctor's mess, this is one of the things. If you are responsible for organizing the education and the training for your colleagues as well, this is one of the things that you can be involved in the management in itself. Leadership in itself, you don't need to be the main leader, but you can be involved in the process. So if you are involved in taking the decision, if you are involved with a morbidity mortality meeting, all of these are kinds of stuff that you can share and show that you have actually took steps in it.
Thank you very much, Dr. Had. Walid, Dr. Walid, can I just ask you, sorry, this is something I see a lot. Not everyone from the IMG, when they sit the exam, had the privilege of actually working or even doing a clinical attachment in the country which they're sitting the exam. I know you started delving into this issue about understanding the lingo, but a bit more recommendation for these people, because a lot of the people coming from abroad and trying to sit the exams, and there's going to be a clinical element into it. What would you recommend? How would they manage if they don't actually understand all the lingo?
Walid is mute. Walid is mute.
My apologies. So there is no right and wrong answers here, Mr. Amr, but what I can recommend is find a study partner who is speaking the lingo. It's not an easy way to go. It's not easy task to be achieved, but I myself, when we did the Irish Fellowship of Anesthesia, we had been rehearsing when we are talking about verbal exams or oral exams, we had been rehearsing with each other. So if we are rehearsing with each other, we will learn to talk. One of the big mistakes when you are talking about an oral exam is to study from the book and write your answer. Study from the book and rehearse your answer in writing. You are presenting an oral exam, so look for study partners, get the questions, answer them verbally. And if you record for yourself, or if they record for you at this stage, to debrief you and say, like, I was doing this, this, and that. Yani, okay, you picked one yani, and then 2 minutes and one yani, and then 3 minutes, and like these jargon words, you have to monitor yourself. It's not coming without practice. You have to practice. And as I said in the lecture, fake it till you make it. In order to prepare one lecture, you rehearse it at least 3 to 4 times. If you present any presentation without rehearsing, it's not coming to be the best for the audience, and you will not like it if you watch it video later on. So rehearse it. Rehearsal is to read your slides in front of a camera and watch it again and see your mistakes and correct it again, or someone does that for you. Particularly, you will be much luckier if you find that partner from the speakers, the mother tongue of English or Irish people, if you are lucky enough to get that.
Thank you very much, Dr. Walid. Mr. Hussein Al-Banna, would you care to elaborate a little bit more also on this point?
Yeah, thank you, Mr. Salim. So it's just another point just to add regarding the exams specifically. The problem with these exams, which I found a little bit difficult, and I've seen a lot of my colleagues struggling with, is not really the knowledge. It is concising the knowledge. So the problem, you have 5 minutes for each question. And when you are asked about something and you start to talk in details about everything, actually he wants within these 5 minutes of the question is to ask you maybe 3-4 questions to pass. And the first question usually is a settling question. It is just to make you talk. So this is another point important about rehearsing. It is to time yourself. When you are answering your question, you are saying the most important points. And the other thing, there is one important rule that called the rule of 3. If they are asked about causes, if you are asked about complications or whatever, for example, just make sure that you are mentioning the most important 3 at the beginning, and most probably you don't need to even memorize anymore, just these 3. So in a nutshell, it is about also concising your answers and talking within 5 minutes of everything. Thank you.
Thank you, Mr. Hussein. And thank you to the speakers of the morning session. Anyone want to add anything, or are we going to have a slightly more longer break so people can take their time?
I think we should have a longer break now, Amr, please.
Okay. Thank you, Dr. Ahmed, for helping me and doing all the presentation and sharing this me. And thank you. Going, Mr. Walid, Dr. Walid, go.
Mr. Salim, if Mr. Sulaiman is around or he can hear us, if you can, I am here. Mr. Sulaiman is a senior examiner, so I would really appreciate his input in the term of communication in the exams. If you have any input in that regard, I don't want to miss that chance. Particularly, we have enough time. If you can give us, in a nutshell, what's your advice
for the exam?
Communication during the exams.
Okay.
There was a question about what's the best technique or way to communicate. Particularly, most of examinees are like not British origins. We are Egyptian origins, and we don't have the lingo.
It goes with how to say English language is very important, and sometimes, especially in the UK and the British, they use the difficult word, which is maybe when you listen to a lot of movie and other things, American, they use easier word than the English word. And don't get panic if you have a word in the exam which you don't understand it. It's a very simple question to ask. What do you mean? Sorry, again. There is nothing called this is part of the exam in the especially communication. In the written is different. In the written, you have the piece of paper and that's it. But in the oral exam or OSCE or whatever, then you are asked, if you don't understand the question, ask the examiner to explain it more. And there is nothing wrong with this. That's one thing. It's start to use the easy words to approach. And any exam, in any questions, clinically or even managerial. And it's very important that the UK now that you are not just a clinician, you need to be a profession in the profession of doctor, which is not just clinic. It's how you communicate with patient, with colleague, with the administration manager, and with the public in the street. Then in any situation, if you have a clinical scenario, put yourself in the clinic. Imagine that you're sitting in the clinic. If you have administration or paper or office scenario, which you want to do, think about you're sitting in the office and what's available in you in the office. You know, some of the questions, sometimes they tell you how you manage things while you're in the office, how to check your blood result or any scan or anything. And when you believe that you imagine that you're sitting in the office and next to you is a telephone, it's very easy that I can pick the phone and ask and call. That's simple question. I think that's the atmosphere in the exam. As an examiner, I want to see the candidate in the real life, but in the exam is not a real life. And we know that is not real life. And if you make a mistake, that's not a problem. I'll give you a simple example. I was examining somebody to listen to a fetal heart, for example, and they put the fetal scope upside down. There's nothing wrong. We know that you're in tension. We know that you are in pressure. What I've done as an example, I just turned it up, assigned down for him, and I did not penalize him, because I know this is a stress of the exam. Also, every time you put yourself in the situation and feel that you are in the normal situation. Don't get panic if you make a mistake. The examiners totally understand. And if you even forget statement or a word or diagnosis, how you pronounce it, the examiner will help you, and that's not going to penalize you. The penalizing things is if you get off the requirement. And nowadays, with the OSCE and all of this type of exam, we have certain tick question. We need to hear certain word. And if you are putting yourself in this scenario, you will say, because you do it every day. That's in summary, actually. I don't want to confuse about the exam, because exam is the easiest things in life. Getting other things in life is very difficult. Exam, it's in your hand. And for any Viva, OSCE, virtual exam now, practice, practice, practice. If you practice, go to the patient at night in the hospital and tell them, can I do a practice on you? That's what we used to do a long time ago before we do our Viva. But now it's practice, 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 and let the patient assess you. If the patient is happy, or the one who imitate the patient in the exam is happy, you will pass, because that's the main things. It doesn't matter if you reach the right diagnosis or not, okay, as long as you don't do a fatal mistake. I think that's in summary. If that's okay with you, Walid.
Perfect. More than enough. Thanks so much. I'm sorry for the surprise.
No. It's the contrary. I'm glad that actually I'm working. I'm in the clinic, but I have a space.
Sure. Thanks so much.
Thank you, Dr. Abdelati, and thank you, Dr. Walid, for the suggestion. It was very useful to, as you said, hear it from an actual examiner who actually gives a lot more real examples for all of us to see. And I think one of the things he said very importantly, which in a way also answers one of the questions that's just been written, that I think mainly just focus in the exam in doing it the right way, the way you normally do it on a day-to-day basis. And as Dr. Hussein said, just focus on answering the most common reasons for everything. And that's all we need to focus about. We don't need to worry ourselves so much about what we think about the examiner and whether the examiner thinks it one way or the other. It's more about the tick box points. As long as you answer the right questions, the right answers, you're going to end up with a good mark at the end of the day.
Exactly.
Okay. if you don't mind, in that case, I will again thank everyone. Thank all the speakers for the morning session. Thank my colleague, Dr. Ahmed. Thank the additional people that very kindly contributed in the answers, like Dr. Abdrati and Mr. Hussam. And I will end this session, but please, we will see you all 11 o'clock sharp for the second session of this meeting.
11 o'clock UK time. UK time.
UK time.
Yeah.
Definitely.